Welcome to this edition of Best of the Best, where we interview the world's leaders in healthcare, politics, sports, and business while sharing their secrets to success. Now here's your host, Dr. J. Murray Hawkins.
Dr. Laura Lee and the staff at Best Life Chiropractic and Wellness Center take a holistic, whole-body approach to health and healing. This whole-body approach to healing allows her to not only treat patients from a chiropractic standpoint, but also allows her to offer advice on nutrition, supplements, and lifestyle choices to improve quality of life. Dr. Laura and her staff have helped thousands of patients eliminate unnecessary medications from their day-to-day life, avoid surgery, and regain their health through a state-of-the-art approach and more than 20 years of clinical experience. She treats prenatal mothers, infants, pediatrics, adolescents, adults, and seniors. Dr. Laura has a board certification from the Academy Council on Chiropractic Pediatrics, is a certified chiropractic sports practitioner, has advanced training in prenatal and pediatric care, and is certified in Webster's prenatal technique. And by the way, she's also my personal chiropractor too for the last 7 years. So Dr. Laura, welcome to Best of the Best.
Thank you. It's great to be here.
Yeah, so first question we have for everybody who's watching right now is, so what is chiropractic? Kind of explain what it is so people get an overview of that.
Well, chiropractic is actually very simple, but the results are profound. So chiropractic is removing the interference in the body that can create issues that relate to stress, issues that can relate to pain, and issues that can relate to function.
Okay. And so how does the chiropractor actually do that? Like, what is the main premise and techniques?
Right.
Yeah.
Well, for us, first we need to evaluate the root cause of the issue. So you might have pain, and not only do we need to see where that pain is coming from, but what is causing that pain. Okay. So once we identify that by a series of orthopedic, neurological, and different nervous system scans, we might also refer you for x-rays. But once we identify that, then our main goal is to provide a technique that is best for you and your spine and your overall body, and help remove that interference. So it could be with our hands, it could be with tools, or it could be with different machines or equipment.
Okay. So why did you want to become a chiropractor in the first place?
Well, I have some family members that are chiropractors, and when I was helping them out one summer in high school, I saw people come in who were not only in pain, but they also had, just an affect of not feeling well. You could tell that this was really affecting their life. And overseeing the course of their treatment and their care, I saw that not only did their symptoms improve, but their overall life and their health improved. And they maybe went from being kind of grumpy or being depressed, and now to living life their fullest. And there was no doubt that I wanted to be a part of that.
That's awesome. So let's talk about like the difference between a specific chiropractic adjustment, which doctors of chiropractic are trained to do, versus the manipulations that osteopaths and physical therapists do. What's the big difference?
So the biggest difference are chiropractors are trained for specific adjustments in the spine or any joint. When you talk about gross manipulation, whether it's an osteopath or a physical therapist, they're doing gross or big, large movements of large joints. And so there's a huge difference. Okay.
So like say, for example, like if your best friend grabs you behind the back and lifts you up and you hear pop, 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 that's more like a manipulation. It's not very specific.
Right.
Or someone walking on your back versus a specific chiropractic adjustment.
Just because you hear a bone move doesn't mean that it's being adjusted.
Okay. So is chiropractic care just for back pain?
Absolutely not. Although people might see a chiropractor because they're in some kind of pain. Chiropractic is so much more than that. Our goal is to get your body functioning at its optimum so that not only you feel better, but you heal better. So a lot of side effects of chiropractic are, it might help with your allergies or your asthma, headaches, trouble sleeping. And it's not because chiropractic cures those things, but when your body starts functioning at an optimum level than what it is currently functioning at, it's amazing how many things improve and get better, and you don't need to take a medication for that or a supplement or a pill.
Yeah, I mean, my story is kind of personal like that too. Like when I was 4 years old, I think I told you this, when I was 4, I had a really severe case of croup that was leading to bronchitis pneumonia, and my mom and dad had me in the hospital for 2 weeks.
Right.
You know, when I was 4 years old, I remember this like plastic tent over my head where they would pour ice behind it to keep the air moist so I could try and breathe. But I was coughing nonstop, like bronchial tubes were constricting, and nothing in medicine helped.
Yeah.
So my mom took me out as a last resort to a friend of hers who worked for a chiropractor. 3 adjustments in the upper back, boom, the croup was gone.
Right.
You know, because for that, again, that specific thing that was causing my problem was that interference.
Right.
Now, that's not to say that chiropractic cures croup,
Right.
but for me, there was that interference. And once that went away, that's why medicine didn't work.
Exactly.
Because they weren't addressing the cause of it.
Yes, and we see so many patients, whether they're infants, children, or adults. We see so many patients who they have tried so many things, or they think that there is no hope. And they come to us and they realize that maybe all the things they were doing were good things, but it wasn't addressing the root cause of the issue. So we see a lot of pediatrics in our office for ear infections, and it's not because chiropractic cures ear infections, but we do specific techniques and cranial adjustments as well as eustachian tube adjustments that help promote drainage, which is what is mostly causes the pediatric ear infections, is just a drainage issue. And once that drainage isn't able to properly drain, it leads to an ear infection. So we're really able to promote the function that way. So that makes perfect sense why that helped. I'm sure it felt like a miracle to your mom and to you, of course. But that is not an uncommon thing to hear, where you know, kids are suffering from something and then you take them to the chiropractor and all of a sudden they start getting better quickly. Yeah,
now you're known as an expert clearly in the country on pediatrics and prenatal care and adjusting pregnant moms, that kind of thing. So let's get into that now. So let's talk more about the prenatal care that you offer moms.
Okay, well that's a great question. And in our office, we are all trained and certified by the ICPA, and so we all have our CACCP certification, which basically means we have taken over 100 hours and also passed an exam to be certified to treat pregnant and pediatric infants in our office. That's not to say other chiropractors don't treat them as well, but we are specifically certified to do that. We've taken all the required courses to do that, which is why we see so many of them in our office. Prenatal care is so important. Anybody who's been pregnant or knows anyone who's been pregnant, your body goes through amazing changes in 9 months. And so chiropractic care really helps your body adapt to those changes and the stresses that is caused on your body. We help to make sure that you're kept in balance. So not only you feel good during your pregnancy, but you're in good balance and alignment. That leads to shorter birth, less interference, less medical intervention. And in fact, we have many groups of OB-GYNs and midwives that refer to us continuously because chiropractic care is so beneficial during pregnancy.
Yeah, and I can attest to that. Like my wife, you know, Tracy, when she was pregnant, she was so skinny, like she's like this rail. She was like 102 pounds when she got pregnant with our daughter. And when she was growing up, her doctor already planted the seed that because she's so tiny that she would have to have a C-section if she ever got pregnant. And so she got chiropractic care every day while she was actually pregnant, no problem. And having a 7-pound, 11-ounce baby, someone who's still that skinny. So, and it was all because of the chiropractic care she got.
It sets it up for success. So it's really a useful and what I think is an essential, thing to be doing during your pregnancy because it can just help alleviate so many issues, but also it just sets yourself up for such an amazing delivery leading up to that.
Okay, so now let's pivot. So now that's the prenatal part. So now what about the postnatal care?
Well, postnatal, now your body's trying to recover from making and having a baby on the inside, while now you're trying to take care of the baby on the outside. So we help adaptation. Your body not only heal from the pregnancy and from the delivery, but also help to adapt to the stressors of, nursing a baby, taking care of a baby. Now you're not sleeping as well. And when you are sleeping, you're sleeping in funny positions. So it's so useful for the mom to get postnatal care to help get your body back after pregnancy.
Okay. So now, obviously now the mom had the baby. Right. So now let's hop into, okay, so should kids like infants, adolescents, and teens should they actually get chiropractic care too, or should they wait till they're an adult until they get some kind of pain before they come and see you?
Well, isn't the saying an ounce of prevention is worth more than a pound of a cure? So by seeing you at your major milestones starting at birth, not only are we able to diffuse any issues that might come up, but we're also able to help your body adapt to all the changes of a growing child. So a lot of people think, well, my baby doesn't have neck pain, so why should I take a baby to the chiropractor? But it's really not about that, and it's so much more than that. So obviously the birthing process is stressful, even if it goes perfectly. So even if there's no intervention, the birthing process in and of itself is stressful for both the mom and the baby. So by fine-tuning the spine and some areas of stress that are common for infants and newborns, and we just use very light touch. It's like a little massage, but it's very specific. We're able to release those stressors on the body, and so nursing can go better, less colic, issues of torticollis don't progress, flat head, things like that. The babies are able to just adapt to life a little bit easier and sleep more and feed better and have less digestive issues. And then, some babies are born with some issues like torticollis, and we address those in our office. And that's when if your baby's always wanting to turn its head to one side and then you're starting to see a flat spot, that's torticollis. And sometimes babies end up in helmets for that, or they end up in kind of uncomfortable PT, we can help alleviate all that. And we actually have a lot of pediatricians and nurse practitioners that refer to us for that. Okay. But if your baby doesn't have any, what you would normally see as issues, then we just check them at milestones. Their little bodies go through so many changes, and we're helped to alleviate the stressors on the body. As they're going through those milestones. And then as children and into adolescence, the same principle applies. We're helping to decrease the effects of stress on the body. And we know that stress on the body accounts for so much of disease processes in our lives. So by helping our bodies adapt to the stress better, then we're able to help not only live a healthier life, but have less issues. So kids who come in and maybe they have ADD or ADHD, or they have anxiety. Now we're seeing so much anxiety, especially since the pandemic. Yeah. By calming their nervous system down and taking them out of a sympathetic, revved up state and putting them into more of a parasympathetic state, kids are able to adapt to what's going on in their life, do better in school, do better in the home, have better relationships, all because we're helping to balance their nervous system. And then, of course, adolescents, and especially with sports here in Texas, we see a lot of kids who have, been really active in their athletics, and it just progresses, especially into high school. We help alleviate not only injuries and prevent injuries, but help performance as well, while decreasing all the stresses on their body.
Okay. So let's go back to the kids, because this is something I want to make sure we touch on for parents watching this, is that, obviously when they're infants, they need that for the stretcher, but then they start learning how to walk.
Right.
And if you're a parent, how many times does your kid fall down?
Yeah, they don't get it right the first time.
Right. And they're not rubber. Like, they don't just bounce. I mean, that can still cause some damage. Absolutely. Right. And then as they get older, now they're playing with their brothers or their siblings or friends, and they're outside. Then they learn how to ride their bike. They're falling off their bike. So all these falls and those things can obviously cause some stressors, right?
It can take, yes, it can cause stress, and it can take a huge toll on their little bodies. What to us, because they seem so resilient on the outside, can really start manifesting as different, what we call subluxation patterns, or different patterns of imbalance. And by seeing a chiropractor who's certified and specially trained to see prenatal and pediatrics and adolescents, we're able to negate that, and we're able to identify those before they ever become an issue.
That's awesome. Okay, so now let's get into sports. So obviously, again, we're in Texas, so sports is big here. So talk a little bit about how you help people that had some sports injuries, or that maybe increase their performance for their athletic thing that they're doing.
Absolutely. So I'll go back just a little bit and tell you why we decided, my husband and I are both chiropractors, and why we decided to go and get our sports certification. I had already had my prenatal and pediatric certification, so we, see a lot of kids in our practice. Well, we also have 2 kids. So right now they're 13 and 15, but when they first started out and decided, to try out sports, I really saw the changes and the need for different kind of chiropractic care for them because of the sports that they were doing. And our daughter rides horses. So that's, an even, extra level of another level of sports, because now you're dealing with the biomechanics of the horse as well. So we felt really passionate about going to get our sports certification so that we could add just a better benefit to our patients in our office. So with that said, when you play a sport, it doesn't matter what sport you play, it is repetitive micro trauma, as we call it, because most sports do not use your body in a balanced position. Whether it's golf, which is a unilateral, you're only using one side of your body a certain way, or whether it's something like soccer or basketball, your body is being put under stress for those muscle groups that you're using. And then also, there is no sport that occurs where you don't take a fall here and there, or whether you don't strain something. So by being able to identify those through having our sports certification, we're able to help rehab things much faster. We're able to do things like certain stretches, certain adjustments, and then certain protocols that we send you home with, so that not only are you recovering faster, but where you're getting back in the game and your performance is increased.
Well, and again, I know it's known that most professional sports teams, Olympic teams, they all have chiropractors.
They all have chiropractors.
Right, to help with that. For number one, to help with the injury recovery, but also to increase performance.
Increases performance, because if you feel better, you can perform better. I mean, it's just simple.
Okay, so now let's shift gears now to spinal decompression. I know that's something you guys offer in your clinics as well. So what is that used for, and why is that better than maybe having someone go right away and get cut on a knife, or get some epidurals, or some kind of fusions, whatever, for this? So tell us about that.
Right. Well, we all know there's a time and place for medicine, and most back surgeries come with a lot of risks, and it's not a for sure thing that it's going to help your issue. So spinal decompression is great for anyone who has spinal pain, who has been told maybe they need surgery, or who has been told that it's only going to get worse. Herniated disc, stenosis, facet syndrome, degeneration, arthritis. Those are all things that spinal decompression can help with. And it's a gentle, non-invasive table that you lay on, and it gently decompresses and relaxes and decompresses. It feels like a big stretch, your spine. And then over a series of some sessions, it helps your body help heal itself. So you can actually help heal a herniated disc without, a ton of medication, and without unnecessary injections, and for sure help avoid and prevent surgery.
Yeah, and tell some people that are watching that maybe have those kind of things, like some pain, all the symptoms you talked about, and they're taking pain medication for that, or they'll get an epidural to just numb the area. Tell us the danger of having that happen.
Well, it's just like putting a Band-Aid on a wound that's not healing and trying to ignore it. So it might feel better, but the problem still exists. So that's why we see patients who say, I don't know what happened. I just went to pick something up, and all of a sudden I fell on the floor and I'm in excruciating pain. Well, the pain is not your problem. This has been going on for a while. Something underlying was brewing, and for some reason, your body just wasn't giving you the messages that you needed to do something about it. Or it was, but you were doing things to kind of ignore and suppress that symptom. So we always say pain is a sign. It's like the warning sign on your dashboard, check engine. If we just put a sticky note over the check engine light and keep going, eventually your car is going to get stuck on the side of the road. Something catastrophic is going to happen. And then you can't say, well, I didn't know. Well, you did, because the check engine light was on and you ignored it. The same thing happens with our bodies, and we really try to educate and empower our patients that pain and symptoms is a sign that your body's asking for help. And so when your body starts asking for help and you keep ignoring it, you keep pushing the envelope, you keep stretching the longevity of the issue and the problem, and eventually your body's going to say, I had enough, I can't do this anymore. So whether it's chronic pain, whether it's stress in your life, or whether it's nagging headaches, these are all things that your body's saying, I need help with. So when it comes to issues like pain down your leg, or you're taking a lot of medication, or you're having to go through a series of injections, which, by the way, you can only get so many of those.
Yeah.
That's time to start seeking, what are other things that I can proactively be doing? Even if you've been told there's nothing you can do for it, surgery is inevitable.
Yeah.
Don't accept that and seek help. Come see us, get a second opinion. We actually have a lot of medical doctors and surgeons and orthopedics that refer to us, because a lot of surgeons know that there are steps you can take before surgery is imminent.
Yeah. And again, just makes common sense, right? Before you do something permanent like getting cut on, why not exhaust everything possible that's natural?
Right.
Because maybe it might not work, but you don't know unless you try it.
Exactly.
You can always get the surgery.
Right.
Why not exhaust the natural ways? I think that's one of the messages we want to make sure people are getting.
Yes.
Is try it. You have
this
really
is
nothing
a very non-invasive, gentle, proactive way that not only you can take control of your own health, but help prevent things in the future from becoming out of your hands.
Yeah. Okay, so now let's kind of wrap up and kind of finish this with, for people that don't have any symptoms.
Right.
Like, again, I go to you, at least a few times a month, and I don't have any symptoms.
Right.
I go there because I want to increase my performance and prevent something. So talk about that as far as just the overall preventative wellness and just keeping yourself healthy versus waiting for that check engine light to come on, right?
Waiting for there to be a problem.
Yeah.
Well, think of it this way. You don't go get your teeth cleaned and a checkup at the dentist every 6 months to every year because you're just waiting for that cavity. You're going and you're getting checked because you want to prevent that and you want to identify something before it starts or before it becomes an issue. Well, the same thing happens with chiropractic care. You might not feel bad, but how do you know? We have so many patients that come in for wellness because they just want to take a proactive approach to their health. And they've never felt better after getting a series of adjustments. They have more energy, they have more mental clarity, they sleep better, they don't get sick as often. Especially during this pandemic, we have seen so many people take a proactive approach to their health because it's something that they can do and something that they can control. And most of our patients say, I have never felt better and I didn't know that I felt bad. So it's another thing that you can do to help ensure your, health deposit bank book, so to speak. And I know for me, I've been in practice for 20 years. I have to do more things at 45 than I had to do at 25 to maintain my health.
Amen, sister.
Yeah, but it's an investment. It's an investment. So investing in your health is never an expense.
Yeah, I mean, just like you want to eat well, right? You want to take some nutritional supplements, right? Well, guess what? I think chiropractic is part of that. That's part of my lifestyle. And it just makes common sense. Once you know how that works, why would you not?
Yes. And I think when people understand that and when people start to reflect on what that means, people realize, okay, this is something that I need to check into, which is why you can come into our office and we'll do a nerve scan and we'll see how irritated your nervous system is, even if you feel great. We want to help people be at their best, which is why we called our office Best Life, is because we want you to live your best life all the time. We don't want you to wait until there's an issue. We want you to see you empowered, which is why we talk to you about nutrition, lifestyle changes. It's not because we're telling you what to do. It's because we want to empower you to be the best version of yourself.
Awesome. Best Life Chiropractic is best of the best. So I want to thank you, Dr. Laura, for being on the show. I want to thank you for being my chiropractor. And for those people that are wanting to get more information, they can just go to their website, which is going to be on the bottom of the screen. It's bestlifechiro.com. And then go in and see Dr. Laura. And believe me, you will be glad you went. Send your whole family there. From if you're pregnant, go there when you're pregnant. You go there before you're pregnant, have you take your kids in. It's just awesome. So I want to thank you again for being on the show.
It's an honor.
And again, thanks for watching this episode of Best of the Best. We'll see you in the next show. Have a great day.